And in response to the COVID-19 pandemic, the CDC launched the National Wastewater Surveillance System in September of 2020, which tracks any presence of the virus through wastewater. Here in Kern, samples collected were used for early detection of the Omicron variant. 23 ABC's Brianna Polk was at the Bakersfield wastewater treatment plant today and has more on how their efforts have helped our local public health agency.
What might seem like the average routine when using the restroom is actually a helpful tool for lab analysis. Each flush here in Kern County holds particles of useful information to help stop the spread of COVID-19.
Each sample represents all the wastewater that goes through the wastewater treatment plant in a whole day. And then that gets sent to our lab at UC Berkeley. And in the lab, we concentrate and extract the genetic material from the SARS-CoV-2 virus. And then we can quantify measure how much of that virus is in the wastewater.
Sasha Harris-Lovett, External Relations Specialist at the Berkeley Wastewater Center, says that they receive samples 3 times a week from the wastewater treatment plant in Bakersfield and are able to measure exactly how much of the virus is in the wastewater, which has been going on since September of 2021. Thanks to that, they were able to identify the Omicron variant in the wastewater.
At the start of Omicron, we're actually able to identify that variant in the wastewater, in some cases before clinical testing had identified it in the county. So that was helpful for being able to, the public health officials could know, Omicron has arrived.
Salvador Lira, Industrial Waste Inspector of the Bakersfield Wastewater Treatment Plant, tells 23 ABC that in addition to identifying COVID-19 in the wastewater samples, it also allows for public health departments to jump ahead on the preparation for when the case numbers do happen to spike within the county.
Such as figuring out, where to allocate mobile testing, vaccination sites, and, in addition to that, this data is used to predict changes in hospital utilization, by making sure preparation and, all the necessary resources are there when the cases, do increase.
Now, the data that is collected is being used by public health agencies not only here in Kern County, but throughout the U.S. Coming up at 6, we'll have more on how this data determines which variants are present, not only here in Bakersfield, but throughout various cities here in Kern County. In Bakersfield, Brianna Polk, 23 ABC News, connecting you.
And as we know, COVID isn't just spread through the wastewater. We took an in-depth look at some information from the CDC and have a breakdown for you on other ways the virus infects people. Those who are closer than 6 feet from an infected person are most likely to get infected. COVID-19 is spread in 3 main ways. First, breathing in air when close to an infected person who is exhaling small droplets and particles that contain the virus. Next, having these small droplets and particles that contain COVID land on the eyes, nose, or mouth, especially through splashes and sprays like a cough or sneeze. And finally, touching eyes, nose, or mouth with hands that have the virus on them. And of course, for more information about how COVID-19 spreads, visit the cdc.gov website.